As the White House looks to incentivize women to have more babies, there could soon be fewer childcare options available to families, at least affordable ones. Head Start could be on the chopping block. The program provides free early childcare and health services to about 800,000 kids from low-income families. A draft of the 2026 congressional budget calls for Head Start to be eliminated. The budget approval process is still in its early stages, and it's not clear yet whether Congress will approve those cuts, but it has a lot of folks concerned. Here with us now, Dr. Deborah Bergeron, Deputy Director of the National Head Start Association. Good morning, and thank you so much for being with us. First of all, talk about the people that you serve.
Good morning. Thanks so much for having me. Head Start is turning 60 in May, and for 60 years, it has focused on children birth to 5 and has who live at or below poverty. But what it does is it embraces those children and their families to build stronger family foundations so that children have a better chance long term of really achieving the American dream. And you know what's interesting about hearing the desire to incentivize increased birth rates is something that a lot of folks don't know about Head Start is early Head Start, which is called a birth to 3 program, actually starts with pregnant women. So we know that if we can support pregnant women and babies before they're born and support those families, the babies are born healthier, the families are ready to be parents and to really lay a foundation for that child. And I think programs like this could actually incentivize an increased birth rate because it provides the support needed after a baby is born to a family to really invest in that child and see him or her grow into a beautiful adult, which we see all the time in Head Start. It's one of those programs that's pervasive throughout the country in 50,000 classrooms in just about every community, but it kind of lives beneath the surface. It exists, it's there, but it does its work and doesn't garner a lot of attention a lot of times.
So what's happening right now, Dr. Bergeron, in the interim of concern that a program like this were to go away? Speaking to lawmakers and also folks in so many of these communities who rely on these services, what's being done to head this off potentially?
I really appreciate that question. I think the first part of your question about, what is the concern? So many levels of concern. So first, you mentioned the 800,000 children and families who are currently receiving Head Start services. If that goes away, those are about 1.5 million plus parents who can't go to work. So there's a basic economic function here that is part of the equation. You've got the 250,000 staff that support the Head Start program, and they love the work they do. And of course, they're on edge, hoping that all of this gets remedied. But I think there's a bigger economic impact because Head Start programs are a pillar in communities. They create basic supports for other small businesses and other organizations throughout that community, and even school systems. We have about 13%, 15% of our grants go directly to school systems. So you're talking about impacting the economy on a number of levels. But I think the bigger impact is the long-term impact on what we've been able to do in this country to provide the American dream to every single one of our children. And that's really what Head Start has done well. There are so many stories out there, and I know we don't have time for a lot of them here, but if I could just share with you, I got an email when I was the director of the Office of Head Start. I actually worked for President Trump during his first term in that role and was thrilled with the support that we got from the administration. And a parent emailed me to thank me for Head Start and talked about how when she enrolled her young baby, she had 5 kids, her youngest was a baby, and she had been abused by her husband. Head Start swooped in, took care of that baby, but they took care of her too as a parent. Parents have a lot of agency. They have a lot of say in the program, a lot of choice, which is a big priority for this administration. And her 5 kids all graduated from college. She went back to school and ended up with a PhD. And that's 6 people who were benefited from a program with just 1 child enrolled. It's really got a very dynamic system to it that takes care of whole families and builds strong thriving futures for everyone.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.